co-creation is very important. I think we don't do enough of it in the Portuguese universities. I don't think we do enough of it in universities around the world, in Europe and around the world. And we need to do more of this. And I'd like to congratulate Luis first for this, for actually having a project where he is in the companies, is speaking to the companies, is listening to them and speaking to them at the same time. It is not doing just once, and then once the result is over, he's going home. The whole process is about continuing to do this and make the process go further. In the context of the VCW, I've spoken to different companies about it, and this is what I learned. They not only like to listen from what he says, but they like to know that he's listening to what they're saying to him. Okay? And I think this is very important. This is not easy. It's obviously the way the future will go, although I think it's also the way the past has been. But I think innovation for the future has to be much more methodic. Okay? And method for innovation is exactly what the VCW is about.
We can go from the basic discovery of a molecule at a molecular level up to the public policies, up to the bedside of patients and to the population health. And so one of the things that will make sense to me to think about is, can we build on these two things together and actually bring some of the ideas of the value creation wheel, not only for business and bring it to the market, but also for public policies in health. That will be something that will be helpful to bring. I think that's something that we could think about. Can we extend further the value creation wheel to other areas of application? And if you look on what the European Commission is thinking, they are considering whether they should put lots of money, which means thousands of billions of euros, into promoting research into disruptive innovations. The problem with disruptive innovation is that nobody knows exactly what it means. Everyone says that my innovation is disruptive, and so the question is whether we can actually identify them. And that's where I think that we can think whether there is a role for the value creation wheel in this area or not, and it's again a challenge for Luis to think about it. Okay? Probably you have noticed that we have here the Diana and Tiago, and I think that Luis should one day explain why these names. Let me finish with thanks again, Luis, for creating this opportunity, to the Minister of Economy for being here and looking on disruptive things, hopefully, and for Daniel, the Dean of the SBE, to also to get the support that he gives to these initiatives. Thank you all.
Value creation in health is an important issue for any government these days. We need a better interaction between universities and firms. Our policy in terms of innovation has to do, of course, with building better links between universities and firms, also building better universities for disruptive innovation with startups. What we want is more startups, but it's mostly that more of the startups can have a process that led them to produce innovation and to produce value. Startups that grow.
Who heard about the healthcare city? Value creation, the value creation wheel models are very, very useful to understand reality, to model it, and then to use them for policies, for policy making.
How can the VCW help? And we will start to go into the VCW now in the conference, the VCW that I have behind me. One of the advantages that we have seen on the VCW, it helps us to anticipate, identify, and evaluate impact.
A problem-solving methodology to help organizations, to help people, to help society to solve the problems. And then Tiago appeared. I was working on Diana for many, many years, and then guess what? Tiago, one day, woke up in the morning, I looked to him and I said, probably it's time to have a practical framework. What VCW does is to split between the solutions and the filters. What we do on the filter stage is we try to understand what are the criteria that should be used to filter the ideas. because we're going to have 500 ideas. In some cases, we had more.
We end up with 15 solutions, then we applied the filters, and we decided to move forward with 7 solutions.
These were the major lessons that we learned, that you need to explore all the attributes through brainstorming and feedback with other people, that the collection of filters is also, of course, very important, and we saw that through market and the competitor analysis were also crucial to get the high value product at the end, because it clearly helped us to define our unique selling points and make our statement in the market.
We think that a diversified team is really important for this framework to work.
Quem é que já teve azia? So I hope that with the help of VCW, in 5 years we have a product to help you.
O tema central desta conferência é particularmente original e pioneiro no contexto da saúde. Criar valor através de uma metodologia de open mind em que não há ideias más e que devemos, dentro ou fora da caixa, ou mesmo sem caixa, encarar os paradoxos das nossas empresas de saúde é desde logo um desafio estimulante, vivo e suspeito que absolutamente necessário no contexto dos nossos serviços de saúde.